Hello, welcome to my channel. My name is Esther Omojoba, and this channel handle is Nazi Studio. So if you're joining me for the first time, you're welcome. Okay, here we talk about health tips that will be beneficial to you. Okay, and also talk about content creation, video editing and tips that will help you grow as a content creator. Okay, so stay with me because this video is going to be a long one. Okay, it's going to be a very long one because you are going to learn a lot. Here in this video, I'm going to teach you things about some drugs, okay? The drugs you need to be taking regularly and those you need to avoid due to several health complications, okay? Like if you're an ulcer patient, the drugs you need to avoid, and then the ones you need to take, and also some remedies that will help you build your immune system and vital organs. Okay, so stay with me, and if you haven't subscribed to my channel, do well to subscribe and then give me a thumbs up, and do not forget to click the notification bell so that you will be notified whenever I post, because it's going to be helpful. Okay, yes, you can also check out my shows. There you see entertainment and comedies. Okay, so this is a full brand, like it's a full brand where you get lots of entertainment and knowledge. So you're welcome. Sit tight. Let's do this. Okay, so let's start with ulcer. Okay, if you have watched some of my videos, you know that I've stated so much about this ulcer. So I am here to tell you the drugs you take and the ones you do not take as ulcer patients. Okay, so if you're having ulcer, I know my previous videos, you can check them out. You can see where I stated the signs that you see, what causes it, the bacteria that causes the ulcer, and the things that exacerbates ulcer. Okay, so here I'm going to tell you the drugs you need to take and the ones you need not to take as an ulcer patient. If you want to treat it, the drugs you can use to treat it, depending on the type of ulcer. Okay, but I'm emphasizing on gastric ulcer, okay, or peptic ulcer. Yes. So still tight. Let's go. So ulcer is a wound. Okay, peptic ulcer is a wound that develops on the lining of the small intestine. Okay, when it develops on that lining of either the small intestine or the esophagus. The esophagus is known as the wound that develops on the esophagus is known as esophageal ulcer. So the one that develops on the lining of the small intestine, okay, which is where food passes through from the esophagus to the small intestines to the large intestines, and all that. Okay, the one that occurs in the large intestine is in the small intestine is peptic ulcer. Okay, so it will now affect your stomach lining, stomach walls. Okay, so it is known as peptic ulcer. And then when you now eat hot food, pepperish food, spicy meals, okay, or drugs that will trigger the pains around that area. The pain starts to develop. It will cause inflammation. There will be inflammation and ulceration. It will cause ulceration and bleeding on that small intestine, and that's where you see abdominal pain, because that is the main symptom of ulcer. Abdominal pain, severe abdominal pain, that is the main symptom of peptic ulcer. Okay, and I know you must be wondering, this drug that I'm holding here, this is an NSAID, okay? There is an NSAID, is diclofenac sodium. So what is the main factor about this diclofenac sodium? What does it do? And who is supposed to take it? Okay, so diclofenac sodium is not good for an ulcer patient. It is not good for an ulcer patient. In fact, any diclofenac at all, both potassium and sodium, you need to avoid them. Okay, so there are ways that you can, there are ways that you can prevent pain. Okay, if you're having body pains and you want to treat it, there are natural ways you can prevent it, because this will trigger your ulcer. But there are some school of thought that will say that diclofenac sodium is not harsh on ulcer patients. Like the drug is mild, which is this one. Let me show you. This one is diclofenac potassium. Okay, this is diclofenac potassium. Okay, so and this is diclofenac sodium. I don't know if you can see that, diclofenac sodium. Okay, so this can be mild on an ulcer patient. Okay, it can be mild on an ulcer patient. Why this can be harsh? Reason being that diclofenac sodium, like sodium, any compound that contains sodium, has low absorption efficiency. Like it's low in absorption. The absorption is low, so it will now cause a delay on that lining. Like when you swallow the drug, it will, instead of it to absorb quickly, digest quickly into the bloodstream, to go and do its work while you are taking the drugs, the drug will be slow in absorption, and then causing it to stay longer on that intestine, okay, thereby causing pain there around the area. Okay, why this one, there is rapid absorption process if you take this. So that's why maybe if you go to a chemist or a pharmacy and you complain that you have ulcer, they tend to give you if you need a pain reliever and you complain of having ulcer, they tend to give you this one that contains potassium. It might not be this company, this is a brand, is on its own, but then there are other ones too. The difference is the potassium and the sodium. That's what I'm trying to point out here, and not this company holding here. Okay, so they will tend to give you potassium, like diclofenac potassium. Okay, because it's fast in absorption. It has fast absorption efficiency. Okay, so another one is this. Another one is this. It is called Sodrex. Okay, so this one, so you can take this. Some people will give you this because it doesn't contain caffeine. If you have constant headache, and the headache is, maybe you are having a high blood pressure that causes you headache, and you don't want to take BP medication, you can take this to subside the pain, irrespective if you have ulcer or not. Okay, but this one does not contain, it doesn't contain caffeine, but there is another one known as extra. So people need to take note of this. If you're going to buy this medication, you look at for the one that doesn't contain caffeine. The one that contains caffeine is known as Sodrex extra, while the one that doesn't contain caffeine is just Sodrex. Okay, so you can take that, not constantly, not steadily, just once in a while. It's not something you consume often at all. Maybe you notice any small headache, you don't go carry and go back from house. Don't do that, okay? Maybe you notice any small pains around your body, around your muscles. Just eat, drink enough water and sleep, okay? Drink enough water and sleep. Don't be taking in all these substances all the time, you know. Just any little thing, you go and pack it and put inside your mouth. Please help yourself, okay? Help yourself. Okay, so if you do that, it will help you. There are other ones too. There are other ones that you need to avoid. Another one is aspirin. That one is used to treat pains, okay? It's also used to treat pains, fever, headache, you know, and that's in sore throat. They say it treats sore throat. It's not that it treats sore throat. Sore throat is caused by either malaria, either night fever, okay? Either night fever or symptoms. It will be as a result of either. So sore throat is caused by many factors. It can be caused by bacteria infestation. It can cause. So sore throat can be caused by many factors. It can be as a result of constant night fever, or as a result of bacteria infestation, okay? If you eat what you're not supposed to eat, or you have been drinking dirty water, you know, water that is not purified, you know, it can cause it. Or cold something, constant taking of cold substance into your mouth, it can trigger it. So what you need to treat, if you treat malaria and that has not subsided, you treat bacteria. There are drugs you can take, you know, to take care of that, to treat it, okay? And not going to back aspirin and be leaking. Some people leak it, like they will carry four like this and put it into their mouth and leak while they have ulcer, to end up damaging your intestine, okay, and cause inflammation and ulceration down there. So it will end up damaging things. So it will end up hurting your stomach and causing inflammation and frustration, thereby elevating the pain, exacerbating that pain you have, either on your esophagus, on your stomach walls. Okay, so you have to be mindful of what you're taking when you are having ulcer. Okay, so even this paracetamol, these are all groups of NSAIDs. So all these ones I'm mentioning now, they are under NSAIDs. Okay, they are group of NSAIDs. Okay, they are group of NSAIDs. Yes, this one does not contain caffeine, so it's mild, so you can take it once in a while. Okay, so you know, that is that. So as an ulcer patient, what are the things, having avoided all these NSAIDs, you know, or limiting them, okay, what and what do you need to do? What and what do you need to do? Okay, what you need to do is take water constantly. This one now is a natural remedy, okay? It's a natural remedy. Constant taking of water. Avoid coffee. Avoid taking coffee early in the morning. Instead of taking coffee, take water. Take warm water early in the morning. No, there are people that are used to taking coffee. Once they wake up early in the morning, they drink coffee. That's their first meal for the day. That's their first meal. They will not even eat food till 12. That coffee they just, that one glass of coffee or one cup of coffee is enough for them throughout that morning until noon. So Don't do that. Don't starve yourself and take coffee. No. Take water instead. Then after some minutes, you eat food. You eat a light food. You can even take fruits. What is it called? You can even take some fruits in the morning. Okay, you can even blend the fruits, like a fruit like cucumber. What apple, cucumber, apple, and then blend them together. Add carrots, blend them together, and watermelon. So yes, sure, add watermelon. Then add milk to it, liquid milk, and blend it together. Blend it together, make it like a kind of smoothie form, and drink it in the morning instead of taking coffee. Okay, blend it and drink in the morning, early in the morning, before you see how your stomach reacts, like to be free. Like if you are those that that always feel full, like you take small amount of food and your stomach is big like a pregnant woman. If you take this thing now constantly, if you keep on taking it, you see that you won't feel all of that again, because those are as a result of acid accumulation in your stomach walls, in your abdominal cavity, because of this bacteria infestation. Okay, so if you keep on taking these substances, like these fruits mixtures, blended fruit mixtures, and then take enough water. Eat lightly, and avoid things that you eat, select food, these things you have to select foods if you want to treat this ulcer completely, permanently. So you have to take fruits, this blend of fruits. If you don't even want to blend it, you can just take some pots out of it and then chew. Okay, and then drink enough water. Okay, and liquid milk as well. Alright, and then avoid hot food, avoid spicy. What I mean by hot, spicy food, okay, pepperish food that contains pepper. Eating pepper, like you go and you want to cook 2 cups of rice, you go and pack 500 naira pepper and put inside of it. You are hurting yourself. You are hurting yourself. So don't do that. Okay, so haven't done that, then alcohol. Run away from alcohol, because alcohol contains a lot of substances, fermented, caffeine. You don't know what they use in producing those things. So you already have something that is manufacturing gas inside your stomach, and then you're also adding an excess gas inside of it. It is not healthy for you. Okay, it is not healthy. So cut down on alcohol. Okay, cut down on alcohol. So another thing you need to avoid is these drugs that I've mentioned. Avoid these groups of insects. Okay, avoid the groups of insects. All right, then avoid oily food. Okay, food that contains excess oil and fats. Avoid them. Stew. Some people don't even want anybody eat stew substances. Stew. Like stew, rice and stew, white rice and stew, they feel agitated, okay? It's to start their stomach, so you have to avoid it at that moment until you finish your treatment. But I'm going to tell you the drugs you are going to take if you have peptic ulcer, drugs you're going to take to treat it, and also give you a natural remedy, okay? I'll give you a natural remedy that can take care of that. I have been in that situation. That's why I am telling you all this, okay? That's what I'm saying all this, because I've experienced it. And I know how hurting it is. I know how painful it used to be, okay? So I've known this, so I've experienced it. That's why I'm telling you. That's why I'm bringing it out to your notice, okay? Because I need to push out the knowledge so that people that is suffering from it will also, know the remedy, okay? Because if they buy people, like this is the buy person, you go neglect them, you go they shout, I get dosa, you know, go find remedy, you know, go help yourself take care of it. You go see person like this before, they don't begin to shoot out blood from their anus. Before you know it, they don't vomit blood. It's as a result of that. Sometimes you call it spiritual attack, you call it attack from village people, you will call it all sorts of names that is arrow projected. It's not. It's the results. Is so many people have been diagnosed of this. Like they have been diagnosed of this, and they will, they will just neglect it. So you have to take care of your health. Do the things you can to save yourself. Now, who buying so seriously? So you need to avoid these things. Avoid them. And then live right, eat healthy, take alcohol, take water enough, constant taking of water. In a day, make sure you take up to 4 to 8 liters of water. If you can, take it. It will help you a lot. It will help you a lot. Flash out thousands. Okay. So that is it. So what now do you need to take as an ulcer patient? What are the drugs you need to take to treat peptic ulcer? So one drug is, I won't show you that, so you can just write them down. Okay, you can just write them down, or I'll place it on the screen here. I'll place the how it looks like the drug on the screen. I'll just take a picture of it and place on the screen so that you see what I'm talking about. Okay, so you need you get omeprazole, you get cimetidine, omeprazole, cimetidine, you get gestid. If you are feeling that like you have acid accumulation on your stomach, like you eat small portion of food, your belly don't big, you don't swallow up, you take that one, 5 ml every morning. 5 ml, sorry, take 15 ml morning, 15 ml night. But if it's too much, you just take it 15 ml morning, afternoon, night. Okay, at least take it like that for 3 days. Okay, and then for that omeprazole, just take 1 morning, 1 night. Cimetidine, 1 morning, 1 night. Another one you can take is simacin. Okay, simacin is, I'll place it around here, is clarithromycin. It's an antibiotic. Okay, it will help treat the bacteria. It will help kill off, fight those bacteria causating agents that is causing those depositions that is causing that ulcer. Okay, the omeprazole is a blocker. Okay, it's a H2 blocker. So it will block some. Okay. I won't have to say everything. All right. So then another one you can be chewing. Maybe if you feel any pains, some people will even feel some stuffs on their hands, like you feel like you can't breathe properly. Okay, you feel like maybe if you eat, your food cannot pass down properly to your stomach. It will hang somewhere around there. So you can chew gelatin. Okay, you can chew gelatin. Just chew 4 tablets at once. Okay. 4 tablets at once, and you have a relief. Okay, so that is that. But then if you need a natural remedy, there is one I took because I wanted something very fast and relief, not something that would take for a long period. Like these drugs, you don't just have to take it once and stop, or take it for 3 days and stop. You take it straight for 10 to 14 days if you want to get relief. Okay, you take it straight. You take it straight. Even some will require you to take it for 30 days. Okay, because it is not easy to treat something that has been there. It is not easy. It is not a day something to treat it completely, unless you want a relief. You just want a quick relief. You just drink small. You get the relief for that moment. But then if you eat something that triggers you again, the problem will start all over. So For you to treat them completely, you have to be taking the drugs morning night. Those that requires you morning night. You take them morning night for straight 30 days. Okay, or straight 30 days. You know that how they just, if you get them, they will tell you how to take them accurately. Okay, so then for this one now, this natural remedy is very simple and straight. Okay, it's very simple. This is the one I used when I felt like I needed a quick relief. I needed a quick relief and a straight up something, you know. I needed a quick relief, something that is, you know, that I don't have to repeat all over and over again, you know. Okay, so what is that I'm talking about? That is plantain peel. That is plantain, not the peel. The plantain is unripe plantain water. Unripe plantain water. Okay, I would have shown you how it looks like. Okay, I will place it on this video. Okay, I'll place it on this video, so this to show you how it looks like. Okay, I'll place it on this video. I'll place the pictures here around this video. Okay, so plantain pure water, it just looks like if you don't know, you think it's palm wine. It's not palm wine. It's not palm wine. So is water gotten from fermented and ripe plantain. Okay, so then how do you prepare it? How do you prepare this plantain pure water, a remedy for peptic ulcer? Okay, what you have to do is to get your plantain. Yes, if you get your plantain, unripe plantain, unripe, no be the one we don't put ripe small, and maybe some the one where they keep making ripe, make it go fry am. Maybe that one. Just get the freshly unripe plantain, freshly. Maybe one we don't stay for days. The one where maybe they always bring them not less than 3 days when them come out from the tree. You get them, you buy them. If it's even half matured, like it will be better. Okay, but if since it won't be impossible to get so just get unripe. Okay, unripe, strictly fresh unripe plantain. Okay, get just 2 to 3 bunch. Okay, 2 to 3 bunch, and wash them properly. If you wash them, is it bunch or what is it called? Stick now, like 1 stick, 2 stick, 2 3 stick, either two or 3 hands or fingers. Let's say, okay, let's just call it fingers of plantain, unripe plantain. Get it, wash it properly. After I've washed it properly, then get your bowl or bowl. Get your bowl or gallon. You can get all these 5 liters or 4 liters blue gallon. Okay, you can just get them. Get it. Get your plantain, wash it properly, then cut it. Now dice it into small chunks. Okay, you dice it into small chunks. You then put it into the container. Just pour it into the container one after the other. The container that has cover, that's the essence of it, so that once you are fermenting it, there will not be escape of any gas. Okay, everything will be there. Just like in the village those days, you know, if you want to make fufu, if you want to make apple, as you put everything inside your gallon, you put inside that plastic bucket, that's 20 liters painter bucket, and then pour your water, carry bitter leaf. That's how my mother used to do that those days. carry bitter leaf and cover the mouth, cover it, then use the cover and press it very well to make sure that it's lapped. You can do it like that if you are using a bowl that has tight cover. But then if you are using a container, a jerry can, you now use the inner cover to cover it. You do have inner cover, use the inner cover to cover it before we cover with the outer cover, so that everything will be intact, no gas escape, because it's fermenting that way. So as you have poured in the plantain, the chopped plantain, unripe plantain inside the gallon, then you pour in your water, your drinking water. Okay, if you are using bottled water, if you are drinking bottled water, carry bottled water and pour inside it. If it's pure water you are drinking, just any sterile water at all, something that you can consume, not anyhow water, not tap water. If it's tap water, you can boil it and allow it to cool, allow it to cool, then use it and pour into that container. And then leave it to sit room temperature, on a room temperature. Leave it to sit for 24 hours. Okay, if you leave it to sit for 24 hours, then that's 24 hours. On the morning of that 24 hours, you bring it out, shake it very well, like shake it properly, shake it, make sure it's mixed together very well from the top to the bottom. Make sure it's mixed. Then get your glass cup, and pour into the glass cup. Drink 1 glass cup in the morning before food. Drink it one glass first thing in the morning before food, just like when you are deworming yourself. You take the warm medicine before food. Okay, so as you wake up, let it be the first thing you drink. The taste is not bad. Yes, it's not bad. It's just like palm wine, tasteless. It just tasteless substance. It doesn't have bitter taste. It doesn't have sour taste. Okay, so just drink it first thing in the morning, and then stay for some minutes before you eat your food, and now drink enough water. Okay, and then in the night you drink it 1 glass like that too after meal, like some hours after meal. You eat on time, no be the one way you could eat around 10 o'clock or 9 o'clock, 11 o'clock. Make sure you eat latest 7 o'clock. Don't eat, then allow your food to settle, dissolve, digest properly before 10. Then you take 1 glass and drink before bedtime. Okay, so do it like that repeatedly for 10 to 14 days, and thank me later. Like maybe if you notice that one don't they draw too much, maybe around 7 days. Like when I did my own, it was around 7 days. The thing don't they spoil, like it don't they get some kind of odor, because it was not on fridge. I did not put it on fridge yet. Like some people you can also put, if you have fridge, you can put it in the fridge. Okay, you can put it in the fridge. Maybe after 3 days of doing it, you can now put it in the fridge, not freezer, and don't allow it to block, just in a fridge, so that it will be cooling it. Okay, if you want to drink, then you bring it out for some minutes, and then allow it to be warm a little on a room temperature before you drink it. Okay, yeah, so that is that. So if you don't have fridge, maybe if you notice that it's getting spoiled, okay, and you don't like the taste, you can make another one. Maybe after 6 days, you can put another one, repeat the process of preparing this one, then allow it 2 days before it will get to 7 days. The other one is ready, then you continue from the new one till 14 days. Okay, so after that, You will thank your stars. You will thank your stars because it's going to go marvelously well. You know those things you have been avoiding. And when you are doing this treatment, once you are doing that, you are doing it. Avoid all these things that I earlier mentioned. Avoid them. Those drugs, those food, that will trigger the stuff. Avoid them that time, okay? And then if you treat yourself finish, you can start eating those things small, little by little, and see that it won't affect you at all. Me that don't eat beans before, if you say that I eat beans now, oh my god. Like if I eat beans small, belly don't big like this, I no go fit eat another thing throughout that day. Because the thing no go gree me, my stomach will be like this, no matter what I take, no matter the amount of water I drink, it will keep on disturbing me. So now I can eat beans. I can eat pepper now, but not too much because I still watch it, so it will not go and still pursue me to the sides. So as you are doing the treatment, you just have to limit those things. Just live your life normally. Like you used to, like you are not doing any treatment, and those things that you normally avoid, for it not to trigger the ulcer, still avoid them until after your treatment. Be drinking enough water, and then you will see a marvelous change. You will see a marvelous change. You will see a tremendous change. Okay, so that is that. That is that, my people. So if you have been watching me till this point, I know that you have really learned a lot. If you haven't followed me, if you haven't subscribed to my channel, please do well to subscribe to my channel because there are amazing tips to come on your way. Okay, so subscribe to my channel, drop your comments in the comment section, and then give me a thumbs up. Okay, and don't forget to click the notification bell and that will notify you when next I post amazing videos. I'll also be posting tips on content creation, okay, things that will help you grow your presence online and make small sense. Okay, so then not only here, both on Facebook, and in fact content creation generally. All right, so this channel will really teach you a lot. It will really teach you a whole lot. All right, and then you can also get some funny shots, okay, that will make your day, make your day wow. Like you enjoy yourself once you get to Nazi Studio channel. Okay, so what are the things you need to take? Okay, hi guys, hello. So let's talk about Camosunate. Some people are confused on the way this drug is being administered, okay, the way to take these drugs. Okay, people are confused. This is a good anti-malaria drug. Okay, so for all age brackets, okay, for all age brackets, we have from 1 to 6 years. This is from 7 to 13 years, and this is from 14 years and above. Adults can take this one. Children from 7 to 13 years takes this one, and children from 1 to 6 years takes this one. Okay, so many people are confused on how to take it. Okay, many people are confused on how to take this particular drug. Okay, so I'm going to show you guys how you're going to take the proper way to take the drug. For adults, people take this drug the wrong way. People take it the wrong way. So this is the tablets. Okay, so if you're taking this drug, you will not come and be taking one. Some people, I just found out that some people take it and that's why they complain it doesn't work. Okay, so some people will take it one, take this one at night, take this one down, no, it is not done that way. You take the yellow one and the white one together Okay, this white one complements the yellow one. You take it both, you take both together. Take one from here, take one from here in the morning, and at night you take one from here, take one from here together. Okay, so you won't take one or take one, or you continue taking one white one till you finish the drug, and then you start taking yellow. No. You take one of white and one of yellow in the morning, and at night the same thing. You repeat it the second day, repeat it the third day. That is for 3 days. One white, one yellow. Morning, one white, one yellow. Night for 3 days. That means you are taking 4 tablets in a day. 2 tablets for white in a day, 2 tablets for yellow in a day. Making it 4 tablets for a day, then times 3 days, which is the normal dosage for this particular one. Okay, so don't go and be taking one white in the morning, one yellow in the night, one white in the morning, one yellow in the night. No, it won't work. It won't give you the actual dosage that you need for the treatment. Okay, so for this one, which is for children ranging from 7 years to 13 years. Okay, it is 6 tablets. Okay, the 6 comprimes. So we are going to be taking it just like that. You take it as it is being directed. So for this one, which is for children ranging from 7 years to 18 years, I'm going to show you how we are going to take it. Okay, it is 6 comprimes, 6 tablets. Okay, so you take both together too, not taking one of white in the morning. Many parents make the mistake of this. Okay, you make the mistake of giving 1 tablet at once in the morning, then give yellow at night. No, that's not how it is. Both of them goes together because both complements each other. Okay, you give both of them together once daily, like one of this at the same time, either in the morning or at night. Okay, it is preferred that you give it at night. Okay, so that the child will just take the drug and then sleep, rest. Okay, have enough rest during the night hours, and then tomorrow the same thing at that hour that you gave it. It's not if you give at night, then you go and give tomorrow morning, the next day. No, let it be the same time, let it be the same timing. Okay, give it the same timing. You give in the morning for the first day. If you want to give in the morning, you just give in the morning for the first day, give in the morning for the second day, and give in the morning for the third day. All right, not giving in the morning, tomorrow you give at night, next tomorrow you give in the morning, or you give at night. No, if you want to give at night, just give 1 and 2. Bring out 1 and 2 and give to your child. Let the child take it that night. The next day at night too, give the second dose. Okay, give the second dose, 1 and 2 for the second day. Okay, the third day at night too, give 1 and 2. That is 3 days. Okay, don't give morning and give night, give morning and give night, give morning and give night. No, that is not how it's being taken. So give both in the morning, the next day both in the morning, the third day both in the morning. Okay, if you want to give at night, both at night for the second day, both at night for the third day. I hope that is clear. Okay, so we'll head over for the third one. Check out the next one. So for the third one, For the third one, which is for children between 1 to 6 years. This is for children between 1 to 6 years, okay? Children between 1 to 6 years. So this is how the drug is. Comes in powdered form, okay? It comes as a powdered form that you have to reconstitute, okay? Okay, you have to reconstitute this one, all right? You have to reconstitute it. So how, look at it, it's taken for 3 days like this. So you give one like this two, the pink and the yellow, the pink and the white, sorry, the pink and white. You give just put 2 of them together, hot, and pour together in a cup that you reconstitute it with, okay? So make sure the 2 of them goes into the same cup, that you reconstitute 2 of them the same time and taking together, not using this one. Many people do this mistake a lot. Many parents do this mistake a lot, and that's why you end up constant malaria after treatment. So not giving this one and in the morning, and at night you give this one. No. Give 2 of them together for the first day, either at night or in the morning. The second day together at night or in the morning. The third one for the third day at night or in the morning. If you are giving at night, give at night throughout. If you are giving in the morning, give in the morning throughout, okay? So this is how it works, okay? This is how you get results in what you're treating, all right? So that is that for Camosunate. I hope this was able to help someone. Now, like this video, share and comment, okay? Then don't forget to give me a follow, please subscribe to my channel, don't forget to like and give me a thumbs up, okay? I love you all. So let's head over to some medications that you need to take, okay? Some supplements that is good for your health, that is good for your skin, okay? That will replenish your worn out tissues, okay? There are some supplements that you need to be taking as a healthy individual, not leaving yourself till you get sick, then you remember you need to take. And there are some healthy supplements, there are some nutrition supplements that you need to be taking in order to, stay healthy, all right? So what are these supplements that I'm talking about, or example of the supplements that I'm talking about? Okay, this is called liver oil. Cod liver oil. Have you heard about cod liver oil, or do you know, or have you seen it before and you felt like you don't need it at all? You felt like it's some kind of drug for a sick patient? Yes, it can treat some illnesses, but then you still need it as a healthy individual, okay? It will help replenish your worn out tissues, it will build your immune system, and it will also help build your eyesight, okay? So because of many things that people take, and some kind of cells have been damaged, this one will replenish, it will repair some worn out tissues in your body to make you to have a strong bone and strong teeth, okay? It will help you build a strong teeth, a strong bone. It will boost your immune system. It will give you joint mobility, like your joint will be so fragile, okay, and so active, all right? So it will maintain your heart health, okay, and give you a clear vision. So this is very, very healthy. It's very necessary that you take it once in a while. Called liver oil. You can also use it for daily routine for some period of time, and then also you can also get it in some food that you eat. Okay, so this one is a supplement of it. There is where you can get it naturally, which is the food that you take, the meat, the fish that you take. Okay, so some fish contains cod liver oil. Okay, so it will help in all these things that I mentioned. So you need to eat fish as an adult, as an individual. You really need to, because it's very nutritious. It supplies so much nutrients to your body. All right. So there are also oils, some oils that you can take, some oils that you need to take that is very healthy, which I'm going to reveal onto you now. So what are these oils that is very healthy for you, for your meals, for your body, and for your general health? Number one oil that is very good, exceptionally good for you, is olive oil. Olive oil is an oil that is very healthy. Recommend 100% recommended for your cookings and for your health, for your heart, your heart health, your general heart health. Okay, so it contains lesser saturated fats. It contains a lot of nutrients that will, build your immunity. Okay, your skin health, your muscle health, like general, your brain cells. Okay, another oil too that is healthy for you is coconut oil. Coconut oil is very nutritious. Its functions can never ever be overemphasized. Okay, coconut oil is one of the best oils that is healthy for you to for your cookings, for your meals. Okay, so coconut oil. There are many vegetable oils that are filled with fats, saturated fats. Okay, so coconut oil is one of the purest oils that you can ever imagine. So make sure to use these oils for your meals once in a while. I know they are very expensive. Like, they are very expensive. These two oils, they are very expensive. Okay, so at least once in a while you take it, incorporate it in your food. Okay, incorporate it in your food. Coconut oil is very nice, even for your skin health, for your hair. Okay, so if you can even use it on your hair, and it's a very super oil for your hair, for your skin. It maintains your skin health, it maintains your hair health, your growth, and even your eye follicles. Okay, so coconut oil is universally very recommended. Okay, so I will show you how to prepare this coconut oil right from your kitchen, right from the comfort of your kitchen. Okay, so I will put the video right here for you to see how step by step on the easy method you can prepare your coconut oil from your home. Okay, so hope you guys learned a lot on this teaching, and I hope to see you guys in my next one. Thank you so much. Please like, share, and subscribe. Okay, see you guys. I love you all. Bye.
How to prepare your homemade coconut oil from scratch. scratch. Hi guys, hope you know that coconut oil is one of the best cooking oils, good for your meals and very healthy for your heart. So I'm going to show you guys how to prepare this coconut oil from your home, right from scratch. So I got my coconut. Yes, you have to get a sizable coconut so that the oil will come out in large volume. I deshelled it. So with the help of my grater, I grated it. All right, I added in warm water to it and allowed it to sit for some minutes. All right, and then I had to sieve it out. So this is the sieved outlook, and this is the chaff of it. This is the milk that I'm going to boil. Okay, I allowed it to sit for some other minutes, and then I had to scoop out the excessive fat from it and then added to the pot that I had to boil. So after boiling, I allowed to cool down for some minutes and I sipped. Boom, my oil is ready. My oil is ready, guys. If you love this process and you want to try it, drop your comment in the comment section. Like and follow me for more tips.
Anyway, how do I look? I'm going to remove this hair tomorrow. I'm going to wash it out. Okay, this is the hair I made last weekend when I went for a wedding. Okay, so I normally do not apply gel on my hair. Normally, this is my first time. This is actually my first time of applying gel. My hair is kind of a virgin hair. I only applied the last one once, so it didn't relax properly. I just manage it like that too, for the sake of this object I did. So it's not looking too pretty anymore. So I'll have to take it down tomorrow. So guys, come with me to the shop. I know you must have been hearing voices out there, okay? So come with me to the shop where I work, okay? As a chemist, okay? It's a chemist shop, okay? And let's go and check out what is happening down there. I'll be here for quite an hour, almost an hour. I'll be here, so let's go and check. Let's go down there. Guys.
Body, yeah.